So let's talk about health insurance in this country, healthcare. One of the things that we've talked about is the Big Four agenda, and one of the key cogs and pillars of the Big Four agenda is universal health coverage. One of the critical components of universal health coverage is insurance, so that everybody is able to pay into some insurance scheme, and then that insurance scheme, when we pull in money into it, it then is able to help us access healthcare facilities or healthcare that we need at whatever part of the country, in whatever part of the country. So NHIF comes into this discussion. We've had conversations with NHIF before, with what they've been working on, the strategic plan, the reforms that they've gone through at management level and governance, looking at how best to then manage this particular resource, and encouraging more and more people to contribute towards NHIF, so that as more people contribute to this pool, then NHIF has more money than it's able to give to those who come in need. And you know, there are very many people who will tell you their story of how NHIF came through for them at a critical point in their life. Somebody went to hospital there at that point, and they basically need to get admission, and NHIF, just because they are up to date with their NHIF contributions, they're able to then just access services, depending on, of course, on the level of facility that you're going into. Many people will tell you, I needed dialysis, and NHIF just sorted out dialysis. I needed to go through chemotherapy or any other cancer treatment, and NHIF was able to basically come through for me during this one. So you can talk about very, very many positive stories that have come out of NHIF. And there are very many concerns also that have been raised by contributors. Okay, so I contribute this much, I needed this much, I applied, and then I'm told NHIF cannot cover the full amount, they can only cover X amount. And I was asking myself, so how do they determine how much they want to cover? How do I regularize my account? Cases of fraud that used to be there before, of someone being told, you've actually spent X amount of money through NHIF in the last year. And someone tells you, I haven't gone to hospital in the last year. Fraudsters were in the system. And there's been that attempt at getting rid of those fraudsters in the system. So the whole story of NHIF is big. Yeah? It's a big story. When you've talked about this city many times, you have gone ahead and, as you're engaging with the communities and you tell people, okay, you know what, take advantage of NHIF and what NHIF can offer you. What kind of feedback do you get from people?
Well, first of all, it's alien. And then they believe that it's something that is meant for other people, especially other people who live in towns. And underlying this is that they actually don't believe that you're going to pay this minimal amount. And at the end of it, you will actually get the services that often are back-breaking and require Harambe for you to actually achieve. I actually managed to do this. I decided, let me put these theories of mine into action. And the local border group in my village, I spoke to the young men. And as usual, they told us, we want this and we want the other and we want the other. And I said, folks, let me ask you a simple question. List down the things that bother you the most, the things that, and of course, health was one of them. And I said, now, what if I told you that I can help you find a solution to your health problems? I said, the usual. And I said, okay, how much can you, or you're 30 of you in total, how many can you each contribute on a daily basis? I said 50, 20, 30. I said, no, you'll default. Make it 10 shillings. Every day. Can you do that? Yes. Now we need to open a bank account. I didn't do any of this. I just said, this is what you need to do. Then they have a leadership, but they all have leadership structures. They went to the regional hub, they talked to the NHIF person, and they registered that group of theirs. They were told even what to do, okay? And they kept contributing. And I told them, when it gets to this amount, talk to these individuals. They will tell you how you can pay, and you will all get a cover. And the cover is for you and your family. Now, I knew that the scheme was working in two ways. When somebody once called me and told me, you know that thing that you told us about is working, I didn't know who it was. I don't know what he was talking about. I said, first of all, who are you and what thing? He said, you know that thing about the Carden hospital? I said, yes. He said, I was sick. My child was also sick, went to hospital. It worked. I said, explain. And he explained. Now, all I'm saying was it took that particular experience for somebody to actually need it. I think he just went to figure out, does this thing work? And he was calling me to tell me it actually works. Getting a message across, I felt, would only work if they were contributing to it and they were seeing the benefits of it. Not me telling them and saying, I'll help you do this. The help was the advice and the knowledge. And when they went, they realized the thing actually works. Now, if you don't have it, you can't know whether it works or not. But the testimony of people who've seen it work are very many. Because it is a system which works. I have used it myself when I've been unwell.
Yep.
And you think it is nothing. In those days, we didn't even have all these super covers. All you did was cover the bed. Man, it comes to a hefty amount. And all you do is produce the card and it's done. You just see the cost going down. So it is one scheme that for the most part has been an excellent scheme. But now with the population we have and the need to tweak it to meet the demands of the problems we currently face, that's a discussion that is worth having now.
Let's bring in a manager at NHIF, acting manager in charge of public education at the NHIF, Gilbert Mogambi, joins us on the line now. Good morning, Gilbert.
Morning, Eric. Morning, Drew. Morning, Muga.
Good morning to you, and thank you very much for joining us. Welcome to the Situation Room.
Thank you, sir. On behalf of the Board of Management of NHIF, kindly accept our sincere appreciation for this opportunity you've accorded us to be in the biggest platform, the most intelligent and mature talk show in the country.
Say that again. They didn't hear. Say that again.
Thank you for according us an opportunity to be in the biggest talk show in the country, the most mature and intelligent talk show around in this country.
Thank you very much, Gilbert. Welcome. So let's talk about NHIF. One of the things that you're doing recently is you've talked about the amnesty for people who are contributing. So explain this to us. Before we even get to the amnesty part, the issue of NHIF contributions, how much people need to contribute, and how much then benefits they get out of it. Let's just start from those very basics.
Thank you. Winston Churchill once said, the farther you look into the past, the farther you turn to the future. I want to take Kenyans back down memory lane and tell them that NHIF is a state parastatal that was established in 1966 as a department under the Ministry of Health. The original Act of Parliament that set up this fund in 1966 has over the years been reviewed to accommodate the changing healthcare needs of Kenyans, employment, and the restructuring in the health sector. Currently, the NHIF Act number 9 of 1998 governs the fund. The transformation of NHIF from a department in the Ministry of Health to a state corporation was aimed at improving effectiveness and efficiency. I want to tell Kenyans the functions of NHIF. As I said earlier, the current act that governs NHIF is number 9 of 1998. And pursuant to that act, Section 3, Sub-Article 2A, the act mandates NHIF to receive all contributions and other payments that are required to be paid into this act or to the fund. Secondly, Section 3, Sub-Article 2B and Section 22, Sub-Article 1 of the NHIF Act mandates the Board of NHIF to pay benefits to members, to beneficiaries, in events they are admitted or hospitalized in any of the NHIF empaneled facilities. Remember, the same Act mandates the Board, in consultation with the Minister and the Chairman of the Medical Practitioners Board, by notice in the Gazette notice, to declare any hospital, nursing home, or maternity home to be a hospital for purposes of this Act. And the vision of NHIF is to be a world-class, universal social health insurance. And our mission is to contribute towards universal health coverage. Remember, we're in the UHC era, in provision of affordable, accessible, sustainable, and quality health insurance through strategic risk pooling and healthcare purchasing, of course, in collaboration with our stakeholders. As per the books of records, that is the financial books, the cumulative membership of NHIF as at 30th June 2020 was 22 million beneficiaries, constituting of 9.5 million members and 12.5 million declared dependents. And when I talk of declared dependents, it implies the declared spouse in our database. Secondly, it implies children that are served by the declared spouse or dependent or adopted children. Currently, NHIF has a branch network of 156 service points that are spread across the country, whereby we have 70 branch offices which are in the 47 counties. We also have 33 satellite offices, and members of the public can also access services in the 53 Huduma centers that are spread across the country. Of particular importance of what I want our members to know, that NHIF has undergone digital transformation. You do not have to visit any of the NHIF offices for you to acquire services. We are available on the digital platform. That is through the self-care platform. That is for those who are blessed to have a mobile telephone. You can dial star 155 hash from your feature phone, or what I call Mulika Mwizi. For those of you who are blessed to have an Android phone, you can download my NHIF app, which is available in Play Store and Google Store. We also have a 24-hour customer call center, and there's a toll-free line which is 0800 720 621. Over to you, Eric.
Very, very good introduction of NHIF and what you've been doing. Let me just focus on the 9.5 million members, and these are the contributing members, right?
Yes, sir.
How many of these, or what percentage of these, are people who contribute from formal employment through direct employment, and how many are, what do you call them? Is it voluntary members?
Yes, as I mentioned earlier, we have two cadres of members in NHIF. We have the voluntary members and what we call informal sector, Juakali. As mentioned earlier, at NHIF, we administer 2 tiers of schemes. That is the national scheme, which is also our flagship, known as Super Cover. And we also have other schemes. When I talk of other schemes, we have other schemes that are subsidized by the government of Kenya. For example, we have Linda Mama, which is popularly known as the pre-maternity program. We have the health insurance subsidy program for orphaned and vulnerable children. We call it OVC. We also have the health insurance scheme for older persons and persons with severe disabilities. And when we talk of older persons, we are talking of Inua Jamii. We also have the public secondary schools cover, which is popularly referred to as Edu Afia, which was launched by His Excellency the President in 2018. Now, for the national scheme, we have the formal sector, that is people who are unemployed, and we also have the informal sector, the Juakali artisan. Now, the question that you raised is the percentages of members of the national scheme and the vis-a-vis the informal sector. To give you the numbers, I'll start with the sponsored program that are catered for by the government of Kenya. One, we have the health insurance or orphans and vulnerable children, where we have approximately 180,000 households that are on board. For orphans and persons with disabilities, we cater for 42,000 households. And for Lina Mama, 1 million Kenyans have benefited from the same. When it comes to the national scheme, I'll give you a percentage. Majority of our members are the national scheme, who constitute about 60% of the members who are members of NHIF.
I see.
Over to you, Eric.
So, I mean, just talking about NHIF and then what it has to offer, I think there's still so much in terms of questions, that the general populace has. It's interesting that Mr. Mogambi has talked about, some of these other schemes, even still within NHIF, that you can have access to, that I think very many folks just are not aware of. Are you paying a different amount? Are you paying a different premium every month? Is a certain amount deducted from you to be able to have this done? Can you pay the first one and then have immediate access to health? These other issues of, do I pay and then 6 months later is when my scheme then is active and I can go to hospital? How much does it cater for? I think with all of these and the different ones that we are seeing, what he's talked about now, Inua Jami, Inua Elimu and things like that, who does it cater to? How much does it help? Do I have to pay more? Do I have to pay less? And I think there's a lot of information floating about that needs to be grounded in terms of what can I do? What can I have access to when I go? Because it's vital. People's health, and then being able to cater for some major medical intervention that you need. And you don't have to pay out of pocket is a big deal for a lot of folk. But it is absolutely necessary for us to know what it is that you can have access to by paying a certain amount every month. I like the fact that there's a lot in terms of what's on the table. But I think it must be streamlined in terms of information to people to get to know what is available.
I think that, the bit about information and sharing information, maybe that's what the job of the public education manager is. And Gilbert, we're happy to have Gilbert on the show here with us. People getting to know. So if I contribute, say, 500 a month, 6,000 bob a year, do I need to know whether I'm in the national? I just need to know that I can access this. However, there's the second bit of, so what do I get out of it once I've contributed, which is the issue that you're raising. So once I've contributed, what do I get? Is there another scheme where I can get something else? And maybe those other schemes are the ones that are very specific. For example, the Inua Jamii one is for people of a certain age or people of a certain social background or inclination or social or ability as well. So if, for example, we are saying that there are people who the government is sponsoring, those ones, have we captured everybody who deserves to be in this particular scheme? How do we, as the general members of the public, how do we get to alert the people that you need to go and register and get yourself registered? Talk to the local chief, who can talk to the local NHIF office, so that then you can get into this particular scheme and start benefiting from this scheme. Because all these are the very, very big schemes. And we still have Gilbert Mogambi with us on the line, acting manager for public education at the NHIF. With all the schemes that you've just told us, Gilbert, and that's the question that Ndu was asking, perhaps Ndu, actually, you can ask him again directly.
So, I mean, there's some that you've mentioned. How do people know who then is eligible for what? And then how does that take care of everybody? Because, I mean, just days ago, having a conversation with someone, and she was of the opinion that if she made a payment, for example, for her dad, that he could have access to, these resources for their health needs immediately. So how do we know who fits into what basket with these themes that the schemes that you've mentioned just now? Or is it the basic minimum that everybody needs to know? You pay your 500 shillings, you pay your 1,700 shillings per month, you have access to healthcare. What exactly are we saying now?
Now, remember, NHIF is a statutory act that was set up by Parliament, and there are two cadres of persons who should join. For people in formal sector, that is people who are salaried, their contributions are pegged on their income. We have a graduated scale.
Yeah.
Now, for people in the informal sector, when we talk of informal sector, we are talking of retirees, Yuakali artisans, Mama Mboga, and others. They can become members by paying 500 shillings, which is the premium for retirees. So in case of the person you mentioned,
and this is 500 a month.
500 a month.
Yes.
Remember, our super cover is the most reliable, accessible, affordable health insurance scheme that offers you and your family unparalleled health benefit packages. Perhaps I'll talk about where the rubber meets the road. What are you entitled to as a member of the super cover? One, as a member of the super cover, you are entitled to inpatient treatment. And when you talk of inpatient treatment, it's whereby you can be admitted in any of the NHIF accredited facilities, and you can be able to access services, whereby you can be admitted for a period of 180 days or 6 months, whichever comes first. And if you exhaust limits, you can always write to the Minister of Health to consider your case on need basis, and you can be attended to. The other benefit package that they're entitled to is the maternity benefit package. When we are talking of maternity, we are talking of normal delivery, which is popularly known as spontaneous vertex delivery. We are talking of cesarean section. For normal delivery, we pay in NHIF declared facilities, we pay up to 10,000 shillings. For the cesarean section, we pay up to 30,000 shillings if you are admitted in any of the NHIF empaneled facilities. Now, the other benefit package that they're entitled to is outpatient benefit cover. They can go to any of the NHIF accredited facilities, and they will be treated. That is, they'll be able to see a consultant, a medical officer of health. They can be able to get services from a psychiatrist or a nutritionist for purposes of outpatient benefit package. The other package that they're entitled to is the renal dialysis package. When we talk of renal dialysis, it caters for the hemodialysis for the needed care plan for the patient, including specialist reviews, nursing and dialysis, intracare, dispensed medication, and routine laboratory tests. We are talking of full blood count, liver function test, creatinine, and others, and of course, counseling and follow-up. And under our renal dialysis benefit package, you get 2 sessions per week. And I want to tell Kenyans that NHIF is obliged to pay for every session you undergo dialysis. We pay 9,500 shillings. For the rehabilitation package, which I want to tell our audience that we shall be marking the mental health week, which I'll share later, we have a rehabilitation package which caters for drug and substance abuse, that caters for rehabilitation treatments for persons addicted to harmful and hazardous psychoactive substances. And for access, this is available in contracted healthcare facilities. And the limit is 1 treatment session per family, whereby we pay 60,000 shillings for 90 days admission in those facilities. For the radiology benefit package, and when we are talking of radiology, Eric, we are talking of magnetic resonance imaging, that is MRI, computed tomography or CT scan, and this is available in NHIF contracted facilities. And for an MRI, we cater comprehensively at a rate of 15,000 shillings. And the family is entitled to 2 images per card. Same case to the CT scan. For the surgical benefit package, for your 500 shillings, members are entitled to the surgical benefit package, which includes, among others, transplant, with the exception of cosmetic surgery. And it is categorized into 3 categories. We have minor surgeries, whereby members are entitled to 3 minor surgeries per card per year. We have major surgeries, and when we are talking of major surgeries, we pay up to 130,000 shillings. And a card entitles a family to 2 major surgeries per year. And finally, we have the specialized surgeries. We are talking of organ transplant, open heart surgery, total hip replacement, and others, whereby we pay up to 500,000 Kenyan shillings.
You know, Gilbert, there are very many questions that I'm sure many of your members have. And if you just agree to this, let's have a couple of minutes where we hear some of the questions that your members would have, some of the concerns that they may be raising, or some of the issues that they may want addressed. You can have a conversation with Gilbert on 0719-012-600. Very many questions that people have on NHIF that they'd like, just to clarify here and there, one or two issues here and there on NHIF and what it needs to do. And that's why we want to hear your call this morning, 0719-012-600. I see Paras Shah is on the line from Mombasa. Paras, just hold on. We'll get you online with Gilbert Mogambi shortly so that you can ask this particular question that you have. And if you've got a question, it's 0719-012-600. He has talked about the very many benefits that you get just being an ordinary contributor to this scheme. Inpatient treatment, you get maternity care, you get dialysis 2 sessions a week, you get rehabilitation for people with who are addicted to substance abuse. You get radiology, surgery, and surgical services. This and many other benefits that you get as a member of NHIF, as a contributing member of NHIF. I'm sure we'll ask some of those questions. At what point do you become a defaulter? And how soon can you start accessing the benefits when you register to NHIF? Those are many other questions. Gilbert Mogambi is still on the line with us. Let's go to the phone lines and hear from Paras Shah in Mombasa. Good morning, Paras.
Good morning, Eric. Good morning, everyone in the room.
Good morning.
Good morning, Paras.
Morning.
Okay. I would like to commend Gilbert on the benefits that the NHIF, the enhanced benefits that they're offering. They've done a really good job. The only question I had was the number of private hospitals on their approved list has reduced considerably in the past few years. And I would like to know why so. Because I actually have been a beneficiary of this scheme. I took my wife for a small surgery in MP Shah, Nairobi, and the NHIF really helped me out. But in Mombasa, I think most of the private hospitals have opted out, except for the bed charges that they approve. So I would like to know why these private hospitals have opted out of this.
Why that is changing. Thank you very much, Paras. Just stay on the line or just keep tuned in and he'll answer that. Josiah in Molo, good morning.
Morning, Latif. Morning, everyone.
Good morning.
Yeah, I've got a question to Mogambi. My dad is a retiree, contributes 500 shillings on a monthly basis.
Okay.
But all of a sudden, I think his provision has reduced, and I would want to know what has driven this or what's causing this. Initially, he was getting 25,000 for his chemo, and currently it reduced to only 18,000.
Okay.
And for this year's contribution, he was asked to pay full year before he enjoys the services. So this disparity is what I wanted clarity on.
Okay.
So that we understand what's driving these changes.
Good question. He'll answer that shortly. Let's hear from Karanja in Naivasha. Good morning.
Good morning, Eric, Kidu, and
Good morning,
Good morning.
Karanja.
Morning.
Communication to ask you, Mogambi. La kwanza nini, wacha niongee na Kiswahili ni hivi. Mwanamke amepata mimba. Na wewe ni contributor, mimi ni contributor. Bibi yangu amepata mimba, nimempeleka pale hospitali kuderiva. Na ile miezi ya ile kadi ya clinic anapatiwa, kuna dawa inaitwa anti-D. How comes wanaambia yule contributor alipe ile anti-D na kadi nimesikia kuna hii ya health care hii ya Mama Gena. Haya. Ya Margaret Kenyatta haya. Na swali la pili. Ikoaje sasa hii kadi? Mtu akienda hospitali hujalipa kwa mwezi moja, lakini ni yule employee wako hajalipa. Lakini ukienda pale wanakuambia hapana, hutatibiwa kwa sababu hajalipiwa. Ili hali ni siku moja, ili hali umetanga hiyo miaka yote lakini hujai kosa kulipa. Hiyo ni swali langu. Asante sana, Eric.
Thank you very much. Gilbert, respond to those before we take more. Starting with the number of private hospitals in the country.
Thank you for the caller from Mombasa. I want to assure him as part of our mandate towards 100% attainment of universal health coverage, there is a deliberate effort to expand the branch network across the country to enhance access to healthcare services. As a matter of fact, we have up to date empaneled 8,189 healthcare providers as at June 20th, 2020, from 4,281 declared providers in 2017. You can note that is an increase of roundabout 66%, and these include government, faith-based, and private hospitals. You note there's been a deliberate effort to expand the length and breadth of services by empanelling government providers. But to go back to the question that the caller raised, some healthcare providers, especially private ones, declined to administer some of the packages we offer.
Okay.
For example, we have a duty as NHIF to ensure we give our members affordable, sustainable healthcare services, and we have a surgical benefit package. What we did, it was willing buyer, willing seller. For the subscribers who indeed subscribed to our benefit package, they were given the surgical benefit package. For the private ones who thought it was not sustainable and who are geared towards profit, they didn't sign up to some of those packages. That's why perhaps the member will stand away.
Okay.
On the issue of chemotherapy,
Yes.
which has been raised by the second caller, that there has been a reduction. What I want to tell the member, NHIF reimburses healthcare providers based on service level that are issued by the Kenya Medical Practitioners and Dentist Board. Remember, we have level 1 up to 6. But for chemotherapy, this is specialized services based on where they access services. For example, the amount he talked, the 18,000 that his father was accorded, can comprehensively cover the member if you were to go to a government or faith-based institution. But if you were to go to a higher-end premium facility, then there could be issues. The money could not be sufficient. We have not reduced the amount. We still continue catering comprehensively for members who hail from cancer. We realize that cancer is indeed a national pandemic which members need to be supported. And what we've done, we've even extended the breadth of the cancer oncology package by including PET CT scan that is now offered at Aga Khan Hospital.
Okay. So why were they asked to pay in full for them to continue accessing the services?
Now, for payments, remember, the definition of a member pursuant to Section 15 of the NHIF Act is one who has remitted contributions up to date. That is a member of regular and good standing. So in event you've not paid your premium, and premium should be paid on or before the 9th of the following month, then you'll be asked to top up. But over and above that, for these specialized cases, we want to ensure that the patient gets the entire continuum of care. And sometimes we propose for them to pay upfront so that they don't end up missing critical services at the point of need.
Which also then segues into Karanja's question on late payment. So the deadline for payment is the 9th. If your employer has already deducted from your salary, but they have not remitted by the 9th, why would you be going for the member? And the member can clearly demonstrate that they have already been deducted.
On the issue of late payment, I want to start by educating Kenyans that contributions due to NHIF should be paid on or before the 9th of the following month. There are penalties or sanctions that arise for payment of late contributions. I'll start with self-employed persons. If you are self-employed and you remit after the 9th, that is, you make late payments, your payments will attract a penalty equivalent to 50% of the late payment. Remember, self-employed persons remit 500 shillings per month. So if you make late payments, you will pay the 500 plus the accruing penalty, which is 250 shillings. In the case of employers like Karanja, who is employed, it is a requirement of the law that the employer deducts and remits their standard contributions to NHIF on or before the 9th. But in event of a default or late payment, the employer is obliged to pay a penalty that is equivalent to 2 times the amount he failed to pay. But they can always write an appeal to the management after paying 25% of the late contributions for consideration. Now, what I want to advise members of the public, in event you realize your employer has deducted and not remitted your amount, kindly get in touch with any of our branch offices or satellite offices so as to enable our enforcement officers to follow up with the said employer.
Okay. Before you answer the other question by Karanja, which was about accessing maternity care, let's hear from two other callers who are on the line. One is Mbarak in Ruaka, and then we'll hear from Henry in Madare. Mbarak, good morning.
Hi, good morning, Larry.
Good morning to you.
It was good. I had this question, and maybe if I can be asked, I can be given some kind of answer.
Yes.
The problem is where what are the benefits of the of NHIF facilities introducing this kind of you need to select specific hospital or specific facilities to get the services, maybe of external, right, 1 day or outpatient.
Okay.
Maybe somewhere you are very far, maybe you selected somewhere in Nairobi, but due to 1 to 3, maybe you find yourself in Garissa and you are sick, you don't have money, so you can't access the inpatient because you
selected a different facility. We'll ask him that question. Thank you very much. Henry in Madare, good morning.
Good morning to you.
How are you?
Mimi nauliza swali mtoto akifikisha 18 years and above na yeye bado anategemea mzazi, bado anaweza endelea kutumia hii NHIF card
ya mzazi?
Yeah.
Are they still considered dependent? Okay.
Na yeye bado ni mwanafunzi.
Good question. Gilbert, you're still on the line.
Yes, I'm still on the line.
All right. So maybe you can start with this latest one by Henry. Upon attainment of the age of 18, this person is still very much dependent on their parent. Are they now considered an adult and no longer dependent?
Now, the NHIF Act is very generous and we cater for our members. The cover provides for dependents. And when we talk of dependents, we are talking of declared children in our database. Now, it caters for children up to the age of 18 years. But after 18 up to 21 years of age, if the children are in a full-time post-secondary education institution, we are talking of tertiary institutions, polytechnics, universities, and colleges, they still continue benefiting from the NHIF super cover benefit package. What needs to happen for Henry, he needs to visit the nearest office and supply documentary evidence indicating that the child is in a full-time post-secondary institution, and they'll be catered for comprehensively. And in event these particular children fall sick, it is a requirement that they bring a copy of the student ID, a letter from the institution indicating that they are bona fide students in that particular institution, and finally, we might once in a while ask for additional evidence, either school fees receipts or others. Otherwise, we do cater for them comprehensively.
Okay. The issue of selection of the facilities.
Choice of facilities, very important. One of the benefit packages, and I said I didn't have time to mention that we administered 10 benefit packages. One of the benefit packages under Supercover is known as the outpatient benefit package, whereby every quarter we accord our members a democratic right to select a convenient facility of choice where they can be able to access outpatient services. For members who are comfortable in their particular outpatient facilities, they do not have to select facilities of choice. And as I mentioned, NHIF has undergone digital transformation. Members do not need to come to our offices to select facilities of choice. By the comfort of their phone, they can dial *155#, or for those of them who have Android phones, they can download my NHIF self-care platform, and from the comfort of their phone, they can select facilities of choice for the principal member, the spouse, and the declared children. What I want to bring to the public is choice of facility is done quarterly, but implementation is biannually. That is in June and December each calendar year.
Okay, so Gilbert, as we conclude the conversation, respond to this question by Karanja. So, wife expecting to get the full benefits of maternity care, and then questions are raised that the principal member has to pay for whatever he was calling anti-D.
I want to first of all, apologize to Karanja, because at NHIF we have a comprehensive package for expectant mothers. We have the free maternity cover, first of all, that was rolled out for indigents under the health insurance subsidy program. We have the NHIF maternity cover that caters comprehensively for normal delivery at 10,000 and for cesarean section at 30,000. We know that there are some errant facilities that have taken advantage of our ignorant members. And Eric, I want to say that knowledge is power. The Holy Book tells us that my people perish because of lack of sufficient knowledge. In event you've been told to copay, I humbly appeal to members of the public to reach out to the 70 plus branch offices, whereby we have what we call quality assurance officers, who are clinicians and medics, who are tasked to ensure that the services rendered to our members meets the need of medical necessity. So we can go to the nearest office and have the issue sorted out.
Okay. Final question by Dennis Nyangule on social media. Kindly ask Gilbert why people who are employed in the private sector cannot get dental services using NHIF, whereas those in public sector can.
A very good question. As I mentioned, at NHIF, we administer two types of schemes. One is the national scheme, popularly known as Super Cover. We also administer enhanced or corporate schemes. When we talk of corporate schemes, we are talking of schemes that the government of Kenya has procured for its staff. For example, we have civil servants, members of the National Police and Kenya prisons. We have government parastatals, universities, county governments, and others. For this enhanced scheme, the government has paid additional premiums to cater for them comprehensively. They are, among others, entitled to optical and dental benefit package pursuant to the aggregate limits of liability, which is about 40,000 for optical and 50,000 for dental. For the national scheme, we do cater for opticals and dental for the national scheme. Under dental, we cater for tooth extraction, and of course, under the outpatient benefit package, consultation, whereby you can consult a dentist or optician. But for the optical services, for optical surgery, they are catered for comprehensively under the surgical benefit package.
Okay. Gilbert, as you can see, there are very many questions that people would like to ask. So let's arrange to have you more often, so you can be responding to some of these questions, and also shed light on what NHIF is doing, new programs that you're introducing, new schemes, new information that you'd like people to know about. This is a platform that we can use.
Thank you, sir.